Thank you. It's an honor to be speaking at CANECSA's very first graduation ceremony. I've called this talk Global Priorities for Anesthesiology in the Post-COVID Era. I'm speaking to you from Christchurch, New Zealand, so greetings from my country, New Zealand, Aotearoa. Christchurch is on the east coast of the South Island of New Zealand. Congratulations to all the graduates. Congratulations from the World Federation of Societies of Anesthesiologists. Today marks an amazing milestone in your careers, and it is something that you should be very proud of. This is a photo of the current WFSA board. In the back row is Davy Cheng from China, our treasurer. Next to him is Mauricio Vasco from Colombia, Walid Habre from Switzerland, our Director of Partnerships, Adrian Galb from the United States, our immediate past president. In the front row, we have Daniela Filipescu, our Secretary from Romania, Amelia Guash from Spain, myself, and Carolina Haylock-Law from Honduras, our Director of Programs. As a member of WFSA, you are part of a global anesthesiology family, an amazing family. WFSA was founded in 1955. We currently have 134 member societies, and we represent anesthesiologists in 145 countries around the world. We have an official liaison role with the World Health Organization, WHO, and this is very important because we speak on behalf of anesthesiologists everywhere at WHO meetings. During the next few minutes, I'm going to very quickly outline the role of WFSA. I'm going to mention a few issues relating to COVID-19 and the impact it's had on work for for anesthesia practice. Also, WFSA strategic priorities for the next 5 years, 2023 to 2028. Firstly, the role of WFSA. Our mission is to unite and empower anesthesiologists around the world to improve patient care. It's important to understand the term universal health coverage, and I'm sure this is a term that is familiar to you all. UHC says that all people should have access to the health services they need without the risk of financial hardship. And it's based on the WHO Constitution of 1948, declaring health a fundamental human right. But as you know, the Lancet Commission in 2015 found that 5 billion out of 7 billion people worldwide do not have access to safe anesthesia and surgical care when needed. The world's population is now 8 billion people, and is likely that the proportion of people with access has dropped since the Commission published its results in 2015. And one of the key reasons for the lack of access is not enough trained anesthesia professionals. This is work we did in 2015 and 2016, the Global Anesthesia Workforce Survey. The scale at the top shows the density of anesthesiologists per 100,000 population. Less than 1 is red, 1 to 3 is orange, and at the right end of the scale, dark green is over 20. And of course, in your part of the world, there are very, very low numbers of anesthesia professionals. We've just repeated the survey and the results will be published very soon. Following the Lancet Commission and some other major events in 2015, there was progress at WHO level. And at the World Health Assembly, which is the main meeting of WHO, Resolution 68.15 was passed. This resolution was entitled Strengthening Emergency and Essential Surgical Care and Anesthesia as a Component of Universal Health Coverage. This was a big deal because it put anesthesia and surgical care on the map at World Health Assembly level for the first time. So what's been the impact of COVID-19? In short, COVID-19 has halted progress on UHC, universal health coverage, and it's particularly affected progress on anaesthesia and surgical care. I'm sure you know this in your own countries, that there have been lots of surgical cancellations where patients' care has been delayed or there's been no surgical care at all. And this has resulted in a large backlog of cases. There was some work done early in the pandemic, and this work showed that after 12 weeks of COVID-19 disruption, 24 million operations were postponed or cancelled worldwide. We don't have more up-to-date figures, but we know that there is a backlog of many, many millions of cases of patients requiring surgical care. Another big issue is workforce well-being. And we're starting to see more and more evidence of significant impact of the pandemic on the healthcare workforce. On the left is a report written by the British Medical Association entitled "The Impact of the Pandemic on the Medical Profession." And this report not only outlined the physical threat of the virus, infection by the virus, but also the longer-term effects on mental health and well-being. So we know that the global health workforce is under pressure, and everywhere I go in the world, I hear a similar story that the workforce is struggling. The photo in the slide is a picture I took in my own operating theatres, and somebody had written, "The whole world is short-staffed. Be kind to those that showed up." We don't fully understand the impact of the pandemic on healthcare. So what are the WFSA strategic priorities? WFSA, the board got together earlier this year, and we looked at our priorities for the next 5 years, 2023 to 2028. And we came up with 5 priorities that were then approved by council and disseminated to member societies. In short, these priorities are the following. WFSA will reinforce the vital role of anesthesiologists in global and planetary health. 2, WFSA will strengthen member societies and enhance professional networks. 3, WFSA will advance anesthesiologist leadership in healthcare. 4, WFSA will work with member societies to ensure a well-trained and resilient workforce. And 5, WFSA will improve safety and quality in anesthesiology. I'm now going to go through each of these strategic priorities in a bit more detail. So the first strategic priority is that WFSA will reinforce the vital role of anesthesiologists in global and planetary health. So we need to be talking to governments and decision makers about the role that we play, and also arguing for greater resources. We need to remind governments of the commitment that they made in 2015 to strengthen emergency and essential surgical care and anaesthesia. And WFSA has been very active at World Health Organization level. We were in Geneva earlier this year in May, and we presented a number of statements which argue for greater resourcing for our specialty. The other thing that we need to do is raise awareness about planetary health and sustainability. In 2021, the WFSA released a global consensus statement on principles of environmentally sustainable anaesthesia. So we need to think about the impact of healthcare on the health of our planet. Strategic priority 2, WFSA will strengthen member societies and enhance professional networks. WFSA is its member society and the strength of DFSA is derived from the strength of its member societies. One way that we can, we circulated a pamphlet earlier this year, which outlined the value of your federation, and we've been really working hard to improve two-way communications with societies. Another way of enhancing professional networks is the World Congress of Anesthesiologists. And we recently made the decision to change from a 4-yearly World Congress to a 2-yearly World Congress. The World Congress is going to alternate between a smaller meeting and a larger meeting, and there's going to be predictable rotation around 5 regions of the world. So the World Congress next year in March is in Singapore. In 2026, the World Congress will be in your region, and the venue is Morocco. 2028, the World Congress is in the Americas, and the venue is Vancouver, Canada. We haven't yet decided on the venue for 2030, but it will be somewhere in South, Central, or East Asia. And in 2032, the World Congress will be held in Europe. Strategic Priority 3, WFSA will advance anesthesiologist leadership within healthcare. Anesthesiologists make great leaders, and they showed that during the pandemic. They were great clinical leaders and also great clinical and non-clinical leaders. So one way we're helping to develop leadership is the WFSA Fellowship Program. Before the pandemic, we were offering around 50 fellowship positions per year. And as many of you know, these are short subspecialty placements in different parts of the world. The key with these fellowships is that they are not just about improving subspecialty knowledge and skills. They're about increasing and improving professional networks. They're about developing leadership and teaching skills. This photo shows is a photo I took in 2015 in South India in a town called Coimbatore, where the Ganga Hospital Fellowship Program is located. The man in the center is Dr. Bala Venkat, the head of the program. On his left is Dr. Ahmed from Nigeria, and on his right is Dr. Nyandwi from Rwanda. And both Dr. Ahmed and Dr. Nyandwi have returned to their home countries after the fellowship and are playing a leading role, not only as leaders, but as teachers. Strategic priority number 4. WFSA will work with member societies to ensure a well-trained and resilient workforce. We've already seen that workforce map, so there just are not enough anesthesiologists around the world. So there are lots of ways that we can do this. One is actually getting involved with workforce planning at an early stage. The other one is the fellowships program, and the main thing there is that we're developing the teachers who will and the leaders who will go on to develop the workforce in their own countries. There's a scholarships program where younger anesthesiologists are given the opportunity to go to meetings like the World Congress. We have a range of short educational courses and online educational resources. And I think one thing that we need to be doing more of is development of wellbeing resources because of the impact of the pandemic on well-being. Strategic priority 5 is this one. WFSA will improve safety and quality in anesthesiology. Patients need to be at the center of everything we do. So one example of this is our short subspecialty courses. Many of you will be familiar with SAFE, Safer Anesthesia from Education, specifically the Safe Obstetric Anesthesia course and the Safe Pediatric Anesthesia course. But there are other courses like Essential Pain Management, EPM, and VAST, Vital Anesthesia Simulation Training, and PTC, Primary Trauma Care. This is an editorial that was in The Lancet in 2021. It was called, "Will the COVID-19 crisis catalyze universal health reforms?" And the writers of this editorial made the comment that the pandemic has brought attention to deep healthcare inequalities around the world. There is an opportunity for us to learn from our mistakes and learn from what went well to build back better, to build more comprehensive and resilient health systems, so that we will be better prepared for the next pandemic, but also better prepared to carry on providing the healthcare for other patients. So here are the key points from this lecture. WFSA's mission is uniting and empowering anesthesiologists around the world to improve patient care. COVID-19 has halted progress on universal health coverage, and we need to remind governments of their commitment to strengthen anesthesia and surgical care. We have an opportunity to learn from the pandemic and build back better. Here are our 5 strategic priorities. We will champion the vital role of anesthesiologists. We will strengthen member societies. We will advance anesthesiologist leadership. And we will work with member societies to ensure a well-trained and resilient workforce. And finally, we will improve safety and quality in anesthesiology. I hope to see many of you at the World Congress of Anesthesiologists, which is taking place in Singapore next year on the 3rd to the 7th of March. Once again, congratulations to all the graduates. I'm sorry I cannot be with you in person, and I hope to see you in Singapore. Thank you.